Hello friends, welcome back to our channel. Low oxygen levels in your body can show up in surprising ways that might not seem connected at first, but they provide important insights into your health. From unusual breathing changes to odd feelings in your hands or feet, these signs can be subtle or obvious, but they all point to one problem. Your body isn't getting enough oxygen to work properly. Oxygen powers every cell in your body, so when levels drop, the effects spread across many systems, often showing up as symptoms that are easy to ignore. Signs like headaches or dizziness might seem like small issues, but others, such as a bluish skin tone or sudden confusion, could indicate something more serious. In this video, we'll explore 12 uncommon but important signs of low oxygen levels. You'll discover how these symptoms relate to oxygen shortages, what they mean for your health, and why catching them early can help avoid bigger problems. By the end, you'll know how to spot these warning signs and what steps to take to protect your health. 1. Rapid heartbeat. When oxygen levels drop, the heart beats faster to keep oxygen flowing to vital organs. This condition, called tachycardia, is one of the body's first responses to low oxygen. While a faster heart rate helps circulate blood, it also puts extra stress on the heart and blood vessels. Tachycardia from low oxygen can feel like your heart is racing or pounding, even when you're resting. Sometimes it can cause chest discomfort or feelings of anxiety. It's common in people with chronic conditions like COPD, chronic obstructive pulmonary disease, or heart failure, and can also happen suddenly due to issues like lung blood clots or severe infections. If the heart keeps working harder without enough oxygen, it increases the risk of complications like irregular heart rhythms, arrhythmias, or heart failure. Persistent rapid heartbeats, especially when paired with fatigue, dizziness, or shortness of breath, should not be ignored. Treatment focuses on improving oxygen levels by using oxygen therapy, addressing breathing problems, or managing heart conditions. Early treatment can reduce the strain on the heart and prevent more serious issues. 2. Excessive sweating. Sweating a lot, especially when it's not related to heat or exercise, can be a sign of low oxygen levels. This happens because the body is stressed and releases adrenaline, triggering the sweat response. Instead of helping the body cool down, sweating, in this case, is often paired with restlessness or discomfort. Cold, clammy skin is a common sign of this type of sweating, showing that the body is working hard to deal with the lack of oxygen. It often comes with rapid breathing or a fast heartbeat as the body prioritizes sending oxygen to key organs. People with conditions like asthma or COPD might experience sudden sweating during flare-ups, while those at high altitudes or exposed to carbon monoxide may notice it as an early warning. In severe cases, excessive sweating can point to hypoxemic shock, where oxygen deprivation begins to harm organ function. This might also include pale or bluish skin, as blood is redirected from the skin to more critical areas. Sweating, combined with other symptoms, can signal the need for urgent medical attention. Treating the root cause of oxygen deprivation, whether through oxygen therapy, medications, or other interventions, is essential. While sweating might seem minor, it often reflects the body's serious effort to cope with an oxygen shortage. 3. Cyanosis. Cyanosis is when the skin, lips, or nails take on a bluish color, signaling that oxygen levels in the blood are too low. This happens when blood has too much deoxygenated hemoglobin, a form of hemoglobin without oxygen, giving tissues a blue tint. It's most noticeable on the lips and fingertips, but can also appear on thin-skinned areas where blood vessels are close to the surface. In mild cases, the color may look more gray or pale than blue, which can make it harder to spot. People with darker skin tones might not see the bluish color easily, but it often shows up in the mucous membranes, such as the inside of the mouth or eyelids. Cyanosis can have many causes. Sudden cases might result from choking, drowning, or a severe asthma attack, where oxygen intake is blocked. Chronic issues like COPD or certain heart defects can also lead to ongoing cyanosis. In newborns, it can indicate conditions like congenital heart disease or breathing problems, which need immediate attention. The speed and severity of cyanosis provide important clues. If it happens suddenly, it could signal a serious condition like a pulmonary embolism, where a blood clot stops oxygen from reaching the lungs. Gradual onset may point to long-term issues like worsening heart or lung disease. Cyanosis always requires quick action. Medical treatment such as oxygen therapy or addressing the underlying cause is vital to prevent further complications and ensure tissues receive enough oxygen. 4. Confusion. When oxygen levels in the blood drop, the brain, one of the most oxygen-dependent organs, can start to show clear effects. Confusion or memory loss often happens because the brain isn't getting enough oxygen to support its normal functions, like thinking, focusing, and remembering things. The impact can range from mild forgetfulness to more severe issues, such as struggling to make decisions or follow simple directions. Early signs may include trouble recalling recent events, finding the right words during conversations, or feeling lost in familiar places. In more severe cases, someone might seem dazed, not recognize people or surroundings, or fail to understand what's happening. This symptom is commonly linked to conditions like COPD, sleep apnea, or acute problems such as carbon monoxide poisoning. People at high altitudes where oxygen levels are lower may also experience confusion as part of altitude sickness. These examples highlight how essential oxygen is for clear thinking and brain function. Syncytial euphoria. One unusual sign of low oxygen levels is a sense of euphoria, or feeling disconnected from reality. This happens when the brain isn't getting enough oxygen, but the body compensates by releasing chemicals like adrenaline. This temporary rush can create feelings of happiness or a strange sense of being detached from what's happening around you. Although it might seem harmless, this state is risky because it can hide how serious the situation is. People may feel overly confident or fail to notice other warning signs, like difficulty breathing or a rapid heartbeat. This is often seen in altitude sickness, where climbers report a sudden sense of joy or excitement just before their condition gets worse. The brain's chemical response to low oxygen can be misleading. While it might offer a brief sense of calm or relief, ongoing oxygen deprivation can cause serious harm, including fainting or even seizures. 6. Visual problems. Low oxygen levels can cause visual problems, often overlooked as a symptom. The eyes rely on a steady oxygen supply, especially the retina and optic nerve, which are sensitive to oxygen shortages. When oxygen levels drop, these parts may stop working properly, leading to temporary or lasting issues. Blurred vision is usually the first sign, such as difficulty focusing, a hazy view, or trouble seeing things clearly at the edges of your vision. Some people may also see spots or flashes of light, similar to migraine auras. In severe cases, tunnel vision, where only the center of your vision is clear, or brief total vision loss may occur. These problems might improve if oxygen levels return to normal, but can come back if the root cause isn't treated. Oxygen shortages reduce blood flow to the eyes, making it harder for the retina to send visual signals to the brain. Prolonged lack of oxygen can damage the optic nerve, leading to permanent vision loss. Conditions like COPD or sleep apnea can cause ongoing visual disturbances, while sudden episodes can occur with carbon monoxide poisoning or at high altitudes. 7. Feeling lightheaded. Feeling lightheaded or dizzy is an early sign of low oxygen levels. The brain needs a constant supply of oxygen to maintain balance and orientation. When oxygen is reduced, it struggles to keep up, leading to unsteadiness or a spinning sensation. This can happen suddenly and is often worse when standing up quickly. Severe oxygen deprivation can even cause fainting or losing consciousness. People with conditions like anemia, lung diseases, or heart problems often feel dizzy because their blood can't carry or deliver enough oxygen to the body. The brain and inner ear, which controls balance, both play a role in this symptom. When oxygen levels drop, the brain directs blood to vital organs, reducing blood flow to less critical systems like the inner ear. This disruption in balance signals causes dizziness or vertigo. Chronic dizziness might mean long-term oxygen shortages, common in conditions like pulmonary hypertension or heart failure. Sudden episodes, however, could point to serious issues like carbon monoxide poisoning or high-altitude sickness. 8. Feeling drowsy. Feeling constantly tired or drowsy can signal low oxygen levels in the body. When cells don't get enough oxygen, their ability to produce energy decreases, leading to a sense of exhaustion that doesn't improve with rest. This isn't the usual tiredness, but rather a persistent fatigue that makes even simple daily tasks feel overwhelming. Muscle weakness often comes with this symptom since muscles rely on oxygen for energy, especially during activity. Without enough oxygen, recovery slows down and muscles may feel heavy, sore, or achy. Mentally, low oxygen can cause difficulty focusing, staying alert, or performing tasks that usually require minimal effort, like reading or talking. Long-term fatigue is common in people with conditions like COPD, sleep apnea, or heart failure. These issues reduce how effectively oxygen is delivered to the body, leading to ongoing low energy. In sudden cases, such as during a respiratory infection or at high altitudes, fatigue can quickly turn into drowsiness that worsens if untreated. Addressing the root cause, whether through supplemental oxygen, medical treatment, or lifestyle changes, can help reduce fatigue. Recognizing this symptom early is important since long-term low oxygen can cause more severe health problems. 9. Nausea or vomiting. Low oxygen levels can upset the stomach and cause nausea or vomiting. Like other organs, the stomach and intestines need oxygen to work properly. When oxygen levels drop, the digestive system becomes stressed, leading to these symptoms, which are often mistaken for unrelated problems. Nausea can also happen because of oxygen deprivation in the brain, specifically in the vomiting center, a part of the brainstem that controls nausea and vomiting. If this area doesn't get enough oxygen, it can trigger these reflexes even without stomach-related issues. Vomiting might occur as the body's way of correcting the imbalance. While nausea is uncomfortable, repeated vomiting can cause dehydration, making it even harder for the blood to transport oxygen. Treating this symptom requires rehydration and restoring oxygen levels. If nausea or vomiting happens alongside fatigue or breathing issues, seeking medical care is critical to address the underlying problem. 10th, tingling or numbness in hands and feet. Feeling tingling or numbness in your hands, feet, or other extremities can indicate low oxygen levels. This happens when oxygen shortages affect how nerves and blood flow work in these areas. Nerves need oxygen to send signals properly, and without enough, communication between the brain and the affected parts gets disrupted. It often starts with a mild pins and needles sensation, but can lead to full numbness if the oxygen deprivation continues. Poor circulation, which is common in people with heart or lung issues, makes this worse. Fingers and toes are especially vulnerable because they are farthest from where oxygen is absorbed and circulated. Tingling and numbness are also common in cases of carbon monoxide poisoning, which blocks oxygen delivery to tissues. At high altitudes, these symptoms may signal reduced blood flow to extremities due to low oxygen availability. Treatment involves improving oxygen supply and circulation, using measures like oxygen therapy, better posture to support blood flow, or addressing underlying health issues. 11th, headaches. Headaches are a common sign of low oxygen levels, but are often overlooked. When the brain doesn't get enough oxygen, blood vessels widen to try to increase oxygen delivery, causing pressure changes that trigger pain. These headaches can range from mild aches to severe throbbing pain, and are often mistaken for tension or dehydration headaches. Because the brain is highly sensitive to oxygen shortages, headaches are an early warning sign of hypoxia, low oxygen. Ignoring them can lead to more severe symptoms like confusion or fainting. 12th, rapid breathing. Rapid breathing, or tachypnea, happens when the body tries to make up for low oxygen levels by increasing the breathing rate. It's the body's way of delivering more oxygen to vital organs and tissues. People experiencing tachypnea often breathe quickly and shallowly, which doesn't allow enough oxygen to be exchanged in the lungs. This can lead to hyperventilation, where too much carbon dioxide is expelled, causing lightheadedness, tingling in the hands and feet, and further problems with oxygen delivery. Chronic respiratory conditions like asthma or pulmonary fibrosis can cause tachypnea, as can sudden issues like infections or high-altitude exposure that limit lung function. In children, rapid breathing can be an early sign of serious respiratory or systemic infections and needs urgent attention. Tachypnea can be exhausting and may worsen other symptoms of low oxygen, like fatigue or confusion. Treatment involves stabilizing oxygen levels using supplemental oxygen, ventilation support, or treating the underlying problem. Thanks for watching. If you found this video helpful, let us know by giving it a thumbs up. Don't forget to hit subscribe and turn on notifications so you won't miss out on more videos like this. We'd love to hear your thoughts. Please share your experiences or questions in the comments below. Stay healthy, stay informed, and we'll see you in the next video.